Hey everyone, my name is Dr. Carl Truesdale and I am a double board certified facial plastic surgeon working in Beverly Hills, California. So today we're going to talk about deep plane face and neck lift and the recovery. What is that like? I get this question so commonly, so if you ever had any questions, today I'm going to answer all of those questions for you. Okay, so leading up to surgery, we really want to optimize you. And that means optimize all of the other medical conditions that you might have, whether that's diabetes, high blood pressure, whether that's weight loss. We really want to make sure whatever that you have is optimized as much as possible. Now, if you have an autoimmune condition, we really want to work with your rheumatologist or your immunologist to make sure that is really well controlled. If you have diabetes, we want to make sure your blood sugars are well controlled because having increased blood sugars puts you at risk of infection and other complications after surgery. One of the most important things that we really want to optimize leading up to surgery is your blood pressure. The number one thing that makes your downtime go up is bruising and swelling and increased risk for hematoma, which is the most common complication of a facelift or a neck lift surgery. All of these things are related to what is your blood pressure. So if you do have pre-existing hypertension or elevated blood pressure, you want to make sure that you're on your necessary medications. So that means working with your primary care doctor, making sure your blood pressure every single time you measure it is at least lower than 120, and that top number, the systolic number. You really want to make sure that you're as normal as you possibly can be. That normal number is usually around 120/80, but we want that consistent. That's important because when I do surgery, sometimes you're a little nervous and overall you're recovering. You don't want your blood pressure to spike. So that's very, very important to make sure that piece is handled. The other things that will make your recovery easier and just make sure you're optimized, making sure that you avoid certain things. Some of those things are caffeine. Caffeine can make you swell. No exercise the day before surgery. Exercise is okay 2 to 3 days before surgery, but 2 to 3 days, leading into surgery, try to avoid increasing your heart rate or doing any strenuous exercise. We want you as relaxed as possible. The other things that can help with your pre-surgery are things that might make your blood thinner. So you want to avoid things like NSAIDs. NSAIDs, or non-steroidal anti-inflammatories, are medicines that basically increase the amount that your blood bleeds, but they decrease pain. So things like Aleve, aspirin, ibuprofen, Motrin, Advil, none of those at least 2 weeks before surgery. In an ideal world, at least 7 days before surgery, because we want you to look as beautiful and as pristine as possible after surgery is done. Part of making me look like a genius and fast recovery means that you're going to be bruised for a shorter period of time. Now, if you are a smoker, it is vitally important that you avoid any type of smoking at least 3 weeks before surgery. In an ideal world, closer to 6 weeks. Now, the main reason for this is it will improve your healing and avoid a dreaded complication, such as a skin necrosis. Now, skin necrosis is when the skin can actually die. This happens because nicotine, all smoking actually decreases the amount of oxygen into your bloodstream, and it makes your blood vessels constrict. That constriction and that issue with tobacco that happens inside and around your blood vessels causes inflammation and blocks them. That means that the blood that is feeding your skin can't get to the distal, the far edges, and it can actually cause the skin to die because you need blood to be able to survive and to live. So you really, really have to, if you are a smoker, stop smoking. It is not worth the risk. All of these things are things to consider before surgery. Now, the day of surgery, you want to make sure that you're wearing really loose clothing. You want to wear anything that is, take off any jewelry, anything that conducts electricity. So whether or not those are earrings or piercings or necklaces, anything like that, make sure that you can take those off before surgery. Now, if you have any kind of press-on nails or in particular nails that have gel, it's really important to take that gel off because we'll use something called a pulse oximeter to measure the amount of oxygen in your bloodstream. You want to remove those things so that when we put your finger in the little device, we know what's going on. Gel is very, very difficult to remove. And so make sure if you are going to go to the nail tech, if you're going to get your nails done, at least give us one finger on each side, just so we can make sure we can monitor you. Now, the other things that can really help are if you're having anything like a brow lift or eyelid surgery, you want to make sure you're taking off any extensions, any weaves, anything like that that might be in the way. Take those things out, unbraid your hair, just so I have good access to your incisions. Those tend to actually hold on to bacteria a little bit more. Now, the night before surgery, take a really nice shower. Make sure you're really nice and clean. Make sure that you're brushing your teeth the night before because you'll be fasting. So I won't want you brushing your teeth the day of surgery. So just get those things out of the way. They're all little small things, but they all add up. Get a good, healthy meal the night before surgery because I don't want you eating anything after midnight. Very important to fast. The reason why is some of the medicines that we can give you make you a little bit nauseous, and we don't want you to vomit or have any issues with that, okay? Very, very important from a safety perspective. The other really important thing is to get a really good night's sleep the night before. Now, sometimes this is hard because you might be a little nervous. If you are nervous or if you anticipate that you might be a little nervous before surgery, please contact the office because sometimes I might give you a little medication to take the edge off the day before surgery. Now, the other important things that you do before surgery are making sure that you are going into surgery with an optimistic and a great attitude. Patients who are happy, who are excited, and really kind of deal with their nerves before surgery tend to do better. I know it's funny, but the brain and the body are finally connected. And so if you can go into surgery with a great positive outlook and attitude, that really, really helps a lot. The other things that I want you to do leading into surgery is really making sure that you are eating a proper balanced diet. So high protein, making sure that your body has enough of the factors, vitamins, nutrients, minerals that it needs to rebuild itself after we give it an injury. So making sure you're eating at least a half of a gram of protein per day per kilogram or pound that you weigh, that will really make sure that you have a good amount of protein so that we can rebuild all that protein, resynthesize so that you have a good collagen synthesis and you heal beautifully. The other things that I'll have you do leading up into surgery. Now, a lot of us are on things like Manjaro or semaglutide. Those things make your gastric emptying a little bit slower. Now, even though for many of my surgeries, I do not put breathing tubes in, I do them with IV sedation, we still don't want you to have anything in your belly. And for that same reason that we have you fast the night before, it's also very important that you stop taking any of those types of medications at least 3 weeks before surgery. That will ensure that we don't have any risk of airway issues, okay? Now, some of my patients like to fast or do diets, those kind of calorie restrictions. I would really like it if you stop doing those things at least 2 weeks before surgery. Very important so that your body is in a caloric surplus so that it can rebuild itself. So give your body the best chance of recovery leading into surgery. If you think about all these things, you will have a smoother recovery. We want you well hydrated. So the week before surgery, we really want to make sure you're drinking enough liquid. This will make your recovery a little bit easier. We'll make sure you're nice and hydrated the day of surgery because we'll need to put an IV in. If you're dehydrated, sometimes it's harder to find your IV, your veins. Now, when you're preparing to come to surgery, bring a photo of you 10, 15, 20 years ago, because I love to look at those as reference points. Bring those with you and I will share with you what I think the differences are. And it helps guide me. Even though when I look at you, I have a pretty good idea of what I might do and how you look different when you were younger. A lot of times it does inform my ideas about how you used to look and what I need to do. I don't want to make you look like a different person. I want to maintain your natural look. And a lot of that can be used as a guide from what you used to look like. So bring that. If you have questions, bring those. Wear comfortable clothing. I recommend clothing that is buttoned up. okay? Anything that is pullover is a little bit more challenging with anything like a facelift or neck lift. Bring nice warm clothes with layers, okay? All of these things are things that you can do in preparation for your surgery and the day of surgery to make sure that you have the most optimum result and recovery possible.